A panel of experts is highlighting healthcare issues faced by members of the 2sLGBTQ+ communities that have worsened during the pandemic. Doctors saying there's still significant gaps in care.
Members of this population have worse health outcomes than their heterosexual and cisgender counterparts.
2sLGBTQ+ communities continue to experience inequities in healthcare during the pandemic, accessing medical services, testing, and treatments less frequently, impacting their health.
Factors include high rates of stress due to systemic harassment, social stigma and discrimination, and a lack of LGBTQ-specific health information.
Citing a national survey from the Public Health Agency of Canada, the doctors say in general testing for HIV, hepatitis C, and STIs dropped by 45% since the pandemic began.
There's a multitude of reasons for that. One of them, in the early days of the pandemic, many services shut down and we were mostly concentrated on COVID. And I still think there is some perception in the public that services aren't fully open and operational, so people don't have that permission to get out, get screened and tested.
These communities also historically face mental health and substance abuse issues at higher levels, and wait times for counseling are lengthy. There's a push to improve access to supports, as a new clinic is set to open in Toronto in July, streamlining services and care.
We're hoping to be able to innovate in this mental health sphere and to provide the services rapidly to people, both for sexual health and mental health.
A surgery that saves and improves quality of life isn't easily accessible. Doctors say wait times for gender affirmation surgery deemed medically necessary have worsened.
We can see in-province waits between 12 and 24 months for upper surgeries, and unfortunately at this point up to 65 months for vaginoplasty in province. And there's been little planning at a provincial level to address access and also the resource needs.
The demand for these procedures is increasing, but there are limited providers, programs, options, and funding offered in Ontario and the rest of Canada.
Many people still have to access care outside of the province or even the country. About a third of patients are having surgery outside of Ontario. And most OHIP-funded surgeries occur in high-volume private clinics outside of the province.
Now, the panel closed with the Ontario Medical Association urging healthcare providers as well as stakeholders at all levels of government to engage and invest in solutions to address these healthcare inequities that have been further exacerbated by the pandemic. In Toronto, I'm Faiza Amin for City News.